The medications that we use in psychiatric medicine, for the most part, are human generics. Clomicalm is a branded product. Elanco makes that product, and that's a tricyclic antidepressant, and most veterinarians are going to have that on their shelf, or at minimum be able to order it within a couple of days. Everything else is going to be non-flavored, with the exception of supplements. There are supplements like Soliquin, which are flavored. Zealkine is a supplement which is not flavored. So if we just talk about medications, they're almost all generics. And so we would want to, talk to the owner about how she's going to medicate her cat or dog with a pill. You can get things compounded. I want to strongly discourage the compounding of medications into transdermal applications. There are at least 2 studies that show that fluoxetine, which is Prozac, which is our #1 medication prescribed in dogs and cats, in my experience, antidepressant medication. We have at least 2 studies that show it is not absorbed through a cat's skin in a reliable way. So please don't bother, because most of these behavioral cases are I'm going to euthanize cases. These are cases that are in jeopardy, and let's not try something that we have a ton of evidence doesn't work. And I know there's some veterinarians watching going, but it worked in this one cat, and that's fantastic. Are you trying to save 1, or are you trying to save 100? Because if you're trying to save 100, don't waste your time on something that potentially could save 1. They have to get a pill in their cat, or it's going to have to be compounded by one of these big compounding pharmacies, which are readily available, into a tiny tab, into a capsule, or into a chewable. We know, or liquid. We know transdermal does not work in cats for fluoxetine. There's some evidence for Clomicalm it does, but that's my personal experience. There's no scientific evidence that it will. So let's just stick with things that go in the mouth, and that way we'll know we're helping the animals.